All right. So, a whole thing is trying to destigmatize male enhancement. So, I'm asking that you like and share our lives. You can also find us out there on YouTube, Instagram, Facebook. We're on all the platforms. You go to our YouTube channel that's really, really growing. Please join our YouTube channel. That's where the bulk of the information is going, where you can go back and look at these live talks and stuff like that. The other platforms is where we're giving you snippets what we talk about and all this other kind of stuff. And there are restrictions out there. Some are more restricted than others. TikTok can be a problem, where, I can get by with saying other things like that. But if you want to get the information, go onto YouTube. Now, today is going to be a deep dive, all right? Because we're going to get a little scientific and all this other kind of stuff. But here's what we're going to do. Our talks are about size matters, and this is what we're getting ready to start. It's called the ED series, the erectile dysfunction series. So, guys, if you're dealing with a little ED or erectile dysfunction, this is the series that you want to watch because we're going to go deep dive into this. This is the stuff that you're not going to get when you go to the doctor. Why? Because they ain't got time. Nobody has time to explain it to you like that. But, if you listen to what I'm saying, you'll get an idea from where all the supplements are coming from, all the different medications that are out there and stuff like that. All this stuff starts to the light bulb starts going off. So, in episode 1, which is today, what we're going to talk about is ED is a blood flow problem. It's not a bedroom problem. All right? Why is this topic first? Because it applies to most men with erectile dysfunction. It reframes the conversation immediately, and it sets us up for the future episodes. Because in the future episodes, we'll go into stuff about hormones, nerves, the psychology of it all, and we'll talk about all that kind of stuff. But in this one, right here, what we're going to be talking about is blood flow. All right. ED is usually a vascular issue. The penis is is just the first place you notice it. Now, you've heard me say this before, that the penis is the first place you really start noticing that there's a blood flow problem. And in this talk, I'm going to kind of get off into that. But you've heard me say this. It's like the barometer. It's the barometer for the whole body. If you've got a blood flow problem in your body, it's going to show up first in the penis. All right. ED is usually a vascular issue. The penis is just the first place you notice it. Now, let me say something that might surprise you. All right. Most erectile dysfunction has nothing to do with desire, attraction, or testosterone. It's usually a blood flow issue. That's why you're seeing all this stuff popping up out there with, you can take the blue chews, the rose, and everything like that, because the scientific community realizes that in most cases, it's a blood flow issue. So if I tell you to go take the pill, I'm going to get a reaction in most cases. All right. Because that's where the money's at. Go for the blood flow. But erectile dysfunction, you got to have 3 things. You got a good blood flow, good nerves, desire, and there's a 4th component, which is psychological. But where's the money at? The money is focusing on blood flow. So that's where all the advertising that you see goes for. It goes for blood flow. All right. Now, what I'm getting ready to do now is like a deep dive. All right. Because if you got this background, then some of this other stuff really kind of gels. And you're like, oh, when the light starts to go off, you're like, oh, now I understand. So what we're going to do is we're going to talk about nitric oxide release, smooth muscle relaxation, arterial inflow, venous trapping, why rigidity equals pressure plus blood volume. Now, I can tell you that when I get off into this, don't try to follow every little thing that I'm saying, because I'm going to give you some of the scientific background to why and what happens. Because when a guy actually gets an erection, there's a lot going on. There's a lot going on. Y'all think the women are complicated? Hey, once you hear this, you're going to be like, okay, all right, Guys are complicated. And when we actually have to think it through, then you start understanding. That's why when you call me for male enhancement consultation, that's free. But when you call me for erectile dysfunction consultation, that's a paid visit. All right. So our ED consultations start off at $200. Why? Because it's a deep dive. I got to really understand what's going on with you so I can figure out what I need to do. But let's just talk about it, and then you'll get an appreciation of what I'm talking about. All right. So the physiology of erections. All right. We're going to do like a scientific breakdown. An erection is a fundamental and a neurovascular event controlled by the interaction of several things happening. When I say neurovascular, that's the nerves affecting the vessels. It's neurovascular. It's a neurovascular event. The brain and spinal cord sends a signal. So it starts out here and it sends a signal down to those peripheral nerves, and then you get endothelial function. Those are the cells that go around the blood vessels, and the smooth muscles physiology kicks in. You get arterial blood flow that comes rushing into the penis, and then it occludes the venous system and is supported by the hormonal system. That's where we get the transition, where we go from a low flow contracted state when you're actually flaccid, that's where it's soft, to a high flow pressure trap system, which is really a hydraulic system. So if your background is kind of down the mechanical line, think the penis is a hydraulic system. All right. And we're going to get into this. But first, let's talk about the flaccid state, when it's actually soft, when you just naturally resting. All right. Like right now, I'm in a flaccid state. I'm chilling. All right. So penile smooth muscle is contracted. All right. As this, you don't have an erection. The cavernosal arteries are usually constricted. Now you got two cylinders that go in there called the corpora cavernosum, and they go through there. All right. So those arterioles that's in there, think about the corpora cavernosum like spongy veins. All right. So when the blood flow comes up, the sponge can expand. All right. Those are the spongy vessels. All right. Not veins, but arteries. You get blood flow. Blood inflow is in the low state. There ain't not a lot of blood flow going through there, so it's contracted. The venous outflow is open. So when it comes in, it can go right back out. Because remember, we're talking about the soft state. The penis remains soft because blood enters and leaves freely without pressure buildup. All right, now, there's some neurotransmitters that are kind of kicking off in there. You get the norepinephrine, endothelin, sympathetic nervous system tone. All these maintain contraction of the cavernosal system. Now, I know this is getting deep, but ride with me. Just ride with me. I'm not ready for that yet. Okay, she was trying to show me some of this. But since she brought it over here, all right, when I talk about the corpora cavernosum, all right, in the flaccid state, can y'all see this? Can they see that? All right, this is the corpora cavernosum. This is corpora spongiosum. All right, these are the ones that actually fill up with blood. So when you go to the erect state, all this dilates up. That's why I'm telling you, think about it as spongy vessels. All right, so these spongy vessels, that's the cavernosal arteries coming in, and you see this right here. These are like the little veins that go out. All right, Lisa's trying to tell me, pick it up so they can see it. All right, once more time so y'all can see the anatomy behind what I'm talking about. This is corpora cavernosum in the flaccid state. All right, you see how it's constricted? This is the corpora cavernosum in the erect state. You see how it's dilated. When I say the corpora cavernosum is like a spongy arterial vessels, that's what it's like. All right, and this thing that goes around it, I don't see if you can see this white line that goes around it. That's the tunica albuginea. Now we're going to get back to that, because when we talk about this hydraulic system that all the guys are walking around with, which is their penis, this hydraulic system, when it expands, it traps. And we're going to get off into that. All right. Now, here we go. All right. So we were talking about some of the neurotransmitters that kind of kick in. All right. Now, what I want to do is keep on talking about there's a psychogenic effect. You get this visual, you get the auditory, you get the fantasy, you get the emotional, you get the reflexogenic. You say, what do you mean reflexogenic? Guys, that's direct digital stimulation. That's masturbation. Reflexogenic. Signals travel through the brain, the spinal cord, down to the pelvis. So it goes from the brain down your spinal cord. Ooh, I saw her. She looked fine. Ooh, I see her. Man, look at her. So it goes down your spinal cord and then down to the pelvic parasympathetic nerves. But you're in the flaccid state. And what nervous system dominates in the flaccid state? It's the parasympathetic. Remember we talked about autonomic nervous system, sympathetic, parasympathetic. All right. So, did I say that right? Yeah. So, now, parasympathetic activation becomes dominant. All right. Now, I hope I said that correctly, because the sympathetic state is when it's really dominating on the flaccid side. Parasympathetic state is the erectile side. Make sure I got that right for you guys. All right. Nitric oxide release. Now, nitric oxide is where it's at. All right. Nitric oxide. Say this with me. Nitric oxide. All right. This is the key initiating molecule event. Nitric oxide is released from noradrenergic, norcholinergic neurons. NANC. Don't get caught up on that. That ain't something you need to remember. Just know that, hey, something happens. The endothelial cell linings to the blood vessels, all right, all that's affected by nitric oxide. It affects the lining, the blood vessels. All right, it produces nitric oxide synthase. That's NOS. All right, those guys that race and all, you're talking about NOS. This is NOS. This is the stuff that goes on. But it causes a reaction where you get the L-arginine that causes nitric oxide plus L-citrulline. So this is where you see all those supplements that they tell you to buy, you know, like the nitric oxide boosters. They have L-arginine in it and L-citrulline in it and all this other kind of stuff, because you need all those components when you're dealing with nitric oxide. There are three major forms of nitric oxide: NNOS, eNOS, iNOS. Don't get caught up on all that. That's a lot of information, but I'm giving it to you so you can understand where I'm at. Ooh, I was about to lose my place because I'm talking about a lot. All right. Now, nitric oxide activates guanylate cyclase. All right. Nitric oxide diffuses into the cavernosal smooth muscle cells. That's what I was showing you on that model. And it activates, basically what we're trying to get to is cyclic GMP. All right. This is important. So cyclic GTP goes to cyclic GMP. Cyclic GMP, that's the mother for you. All right. You got to have it. Everything's aiming for cyclic GMP. And I'm going to tell you why as we get into this. This is the central biochemical event with cyclic GTP goes to cyclic GMP. All right. Stay with me now. Stay with me, because all this is going to start clicking because you start to understand why they do what they do when you start seeing all this stuff on the market that's getting advertised. And all you know is they telling you to take these supplements. You know, they tell you to take nitric oxide boosters. They tell you to take medications for erections. It all goes back to this. So, all right, basically what happens is cyclic GMP activates protein kinase, which lowers intracellular calcium. All right. The lower intracellular calcium means that the smooth muscle relaxes. All right. Now, why does calcium matter? Smooth muscle contraction requires intracellular calcium. So when calcium is high, the muscle contracts. The arterioles contract. When it's low, the muscles relax. All right. And the arterioles relax. So cyclic GMP basically tells the smooth muscles to relax. Now, cavernosal smooth muscle relaxation. All right. The relaxation is where you get the trabecular smooth muscles, those helicine arteries, the cavernosal arteries, all the kind of stuff I was trying to point out on the model. All that stuff starts to relax and blood flow comes in. This is what I was trying to show you here where basically you go from the flaccid state to the erect state. And all this flaccid state to the erect state, flaccid state to the erect state. Lisa's telling me again, I got it down too low, so I want y'all to see what I'm talking about. And this mic is driving me crazy because it keeps swinging to my face. But I'm going to see if it'll stay out there. As long as y'all can hear me. All right. Now, basically, let's talk about the arterial inflow that increases. Now, this stuff right here is really cool. A little nerdy, but it's cool, right? The cavernosal arteries start to dilate. Blood rapidly flows in. The sinusoids, the lacunar spaces, the corpus cavernosum, everything starts to dilate up. This is when you go from flaccid to actually getting erection. Now, penile blood flow may increase from 2 to 3 milliliters per minute. All right, that's moving like this. All right, but when you get erection, it can go up to 60 to 80 milliliters per minute. That's like when you go like that. So that's a big deal when, guys are, hey, I'm being turned on. That blood flow comes rushing in. And that's the whole thing that I want you to understand, that there's a big difference in the blood flow that comes coming into that penis when you actually get stimulated. The penis begins to enlarge and it lengthens. Now, once it expands, it compresses the venous outflow. This is that hydraulic system that we were talking about. As the corpus cavernosum expands, the tunica albuginea stretches, the subtunical venules become compressed, and it traps. So it's a whole thing about blood trapping. It expands, trap. Because I'm so full, nothing else can get in there. Because the tunica albuginea goes around it, but once that spongy vessel increase, now I'm just full. Trap. That's an erection, guys. Blood trapping. That's what we talk about. That's where they talk about, oh, I got a venous leak or whatever. Venous trapping is critical. Many men achieve inflow but fail to maintain rigidity because venous occlusion is inadequate. The erection becomes rigid. Arterial inflow exceeds venous outflow. Intracavernosal pressure rises. Pressure may approach systolic blood pressure. I'm going to say that again. The pressure may approach your systolic blood pressure. When the doctor's checking your heart, they say there's a systolic and diastolic. When you go doo-doo, doo-doo, doo-doo. All right, what we're looking at is systolic versus diastolic pressure. Now, if you're being put on a high blood pressure medication, that high blood pressure medication is trying to lower your systolic pressure. Why? Because the body can't take that high pressure that's banging on all the other arteries, all the other organs in the body. The eyes, the brain, the liver, the kidneys, they can't take that high pressure that's coming in. So they put you on a blood pressure medication to lower it. And there's one organ that's upset. It's the penis. I want all that pressure. I want all that pressure so I can expand those vessels down there and trap and then hold that erection. But the thing is that now I put you on medication where your systolic pressure is lower, so the doctor's happy, but the penis is not. That's what happens where guys say, I don't want to take my blood pressure medication because it affects my erections. Yeah, he's telling the truth. He don't want to take it. So that's when you got to go back to your doctor and say, hey, doc, is there something else that I can do? It's all part of the physiology of what's really happening. Once you wrap your mind around this, you're like, oh, that's why my blood pressure medicines are messing me up and I can't get my erection. But I'm going to tell you one thing. Don't stop taking your blood pressure medications because you got to protect the other organs in the body. All right, let's talk about this full rigidity phase. During maximum rigidity, the ischial cavernosum and the bulbocavernosum muscles contract. All right, these muscles further increase intracavernosal pressure. The penis becomes fully rigid for penetration. Now, I know if you've been watching some of these, they're telling you to do the pelvic thrust exercise and all this other kind of stuff. If you've seen it, basically that's part of the pelvic floor. That's where you get the ischial cavernosum, bulbar cavernosum, all those work into the pelvic floor. So when they telling you in the gym to do all these exercising, whatever, they're trying to get you to strengthen those muscles down there because that will help you maintain erection. That's where all that stuff comes from. You see, I'm trying to tie all this stuff together because you see all the stuff happening out there. You know, one person saying this, one person saying that. But if you understand the physiology behind it, then it all starts to come together. You say, oh, that's why they be talking about doing those certain exercises, you know, to actually increase the pelvic floor. All right, now let's jump into a little bit deeper. Let's get into this whole thing about PDE5 and D-termesis. Phosphodiesterase 5. That's where everything's aimed at. All right, so phosphodiesterase 5 breaks down cyclic GMP, right? And remember, cyclic GMP is the one that's causing everything to lead to dilation, all right? Now, as cyclic GMP falls, calcium levels rise, smooth muscles contract, arterial inflow decreases, venous channels reopen, your erection is over. D-termesis. Horns down. Not horns up, horns down. You're back down to the flaccid state. But how do the PDE5s inhibitors work? When are we talking about drugs like sildenafil? Well, sildenafil is generic for Viagra. Then there's tadalafil. Tadalafil is generic for Cialis. Then there's vardenafil. Vardenafil is generic for, what's the other one? Because we don't hardly write for that one anymore. Cialis, Viagra, Levitra. Yeah, Levitra. All right, but it still works. Now, because what they do is they block PDE5 inhibitors. All right, so now if I can block the pathway, then I keep the nitric oxide around. Then I keep the blood vessels dilated. Then the guy's happy because he got erection. This preserves the cyclic GMP longer. All right, the results are prolonged smooth muscle relaxation, improved blood flow, better maintenance of venous trapping. But here's the important thing that you need to understand. When you're taking these medications, Viagra, Cialis, Levitra, they got variations of them now. The variations are the stuff that you can order, like the Row, the Blue Chew, all this other stuff that's out there on the market that they advertise so heavily for. They're all based on the same mechanism of action. They're all PDE5 inhibitors that are stopping the nitric oxide from being broken down. That basically keeps everything, dilated. Well, it's actually affecting the cyclic GMP. But the thing is that basically it's interrupting the pathway to keep it dilated. All right. So everybody's out there advertising whatever, but they're all basically the same stuff. It's just that I'm going to mix this one with that one, and I might add that one in, and now I can produce something different over here and tell you mine is better. But understand this. They do not directly create erections. They amplify the natural nitric oxide cyclic GMP pathway. Without sexual stimulation, nitric oxide release, they do little. Now, I'm going to touch on this whole thing about testosterone. Testosterone supports erections indirectly. What does it do? It increases your libido, nitric oxide synthase expression. You need nitric oxide to dilate everything up. Penis tissue health, all that's affected by testosterone. Smooth muscle integrity. Low testosterone reduces sexual desire, quality of nocturnal erections, response to PDE5 inhibitors. Remember, I said it's three things. You got good blood flow, good nerves, and desire. Testosterone is the desire component. So yes, it plays into this. That's the hormone. We're going to jump into that deeper on another episode. But why does cardiovascular disease cause erectile dysfunction? Well, erections require healthy endothelial and small arterial vessels. This is important, guys. Penile arteries are only 2 to 3 millimeters. They tiny, tiny arteries inside of that spongy tissue are the corpora cavernosum. The coronary arteries in your heart, they're 3 to 4. So they're twice as big as the arteries in the penis. All right, listen carefully now. The arteries in the penis are smaller than the arteries in the heart. So now, who's going to notice a change in vasculature endothelial cells first? The penis or the heart? It's going to be the penis because the vessels are so much smaller there. That's why I tell guys the penis is a barometer. A lot of times when you see early this onset of erectile dysfunction, it might be an early clue that I'm a future setup for some heart problems. All right. So here are conditions that impair nitric oxide production: diabetes, hypertension, smoking, hyperlipidemia, obesity, sedentary lifestyle. This is why ED is often an early marker for vascular disease. All those things affect your vasculature. If you're sitting on your butt and you ain't paying attention, it's going to catch up with you. Now, let me kind of summarize this whole thing because it's a cascade. All right, you get sexual stimulation that happens in there. Ooh, she fine. All right, then you get the parasympathetic activation because it goes through the spinal cord. Now it's activating those parasympathetic nerves down in the pelvis. Nitric oxide gets released. Oh, that's the mother for you. It's coming in. All right, cyclic GMP activation. Oh, hey, I'm activated now. I'm going to increase cyclic GMP. Yes. Why do we want that increase? Because that's what leads to erections. You get reduced intracellular calcium. The smooth muscles relax. Now the blood vessels actually get bigger. Arterial dilation happens. Increased cavernosal inflow. Venous compression is trapping. And at that point, buddy, you got a full erection. And that's how the cascade happens. Just like that. All right. Now, just to kind of help you wrap your mechanical mind around it, this hydraulic analogy, the penis acts like a vascular sponge inside of a tight, fibrous sleeve. The vascular sponge, that's the corpora cavernosum. The tight sleeve is the tunica albuginea. All right? So when it dilates up, it traps the blood flow in there. Hydraulic system. The process requires opening inflow pipes, filling the chamber, compressing the drainage system. If these steps fail, you don't get a neural signal or nitric oxide production or interior inflow, smooth muscle relaxation, venous occlusion doesn't happen, then you got erectile dysfunction. Well, I know that sounds like a lot, and it is because it is a lot. But I can tell you that's why when you come to see me or you set up an appointment, that's why we charge for our erectile dysfunctional consultations, because it becomes a deep dive in trying to understand why you are having erectile dysfunction, because everybody's not the same. And that's what everybody wants to think. The thing is that these medications that are out there, they're basically shooting at a certain crowd of people. Why? Because if I go for blood flow, I'm going to get the majority of erectile problems, because the majority of erectile problems are blood flow problems. All right. But not always. Why? Because there are three things: blood flow, nerves, desire. But then there's the other one I hardly mentioned, which is psychogenic. All right. So now, that was a deep dive. I hope you guys followed me. All right. Now let's kind of tie some of this stuff down. All right. Because when you got endothelial dysfunction, arteriosclerosis, microvascular damage, this is the same process that leads to heart disease, and it often shows up as ED first. So guys, sometimes erectile dysfunction can be telling you that I'm setting up for a future heart attack. Now, why do the pills eventually fail? He's like, yeah, they used to work for me, but they don't no more. What do you do when the pills don't work? Hey, I'm doing talks about that too. Now, the two main ones that are out there is Viagra and Cialis. That's sildenafil and tadalafil, which is the generics. Now, basically, they enhance nitric oxide. They don't create it. They enhance it by not keeping it from being broken down. And what they're focusing on is phosphodiesterase. So if I inhibit it, which is phosphodiesterase inhibitor, I can stop the breakdown. Basically, it's manipulating the pathway to keep the vessels dilated. Once they figured that out, boom, they made millions. I've told you the story about Viagra. Basically, Viagra was created for the heart. But then they did all the research and they were doing the clinical trials. And the guys was like, Doc, I don't know what it's doing for my heart, but I got these great erections now. Why? Because there are more receptors in the penis for that phosphodiesterase inhibitor than it is in the heart. So it gave a more of an effect down there. So guys got all these great erections. All right. But those phosphodiesterase receptors are other places like sinuses, in the eyes. So you get blurry vision, you get stuffy nose. I had a guy tell me, hey, I think I'm allergic to it. No, what you're experiencing is a side effect of the medication because it's affecting those receptors. So yeah, you take a Viagra, you get a headache, you get blurry vision, you get stuffy nose. That just means it's working. I got a terrible headache, my nose is stuffy, but I got the best erection ever. I'm happy. Yep, that's how it works. All right, here's the risk factors. Diabetes can be a risk factor. Hypertension, smoking, obesity, sedentary lifestyle. Let me be clear. If you're sitting around drinking Dr. Pepper every day and you ain't doing the right things, no, your day is coming. You're going to have some problems. You got to balance this thing out. Stay active, people. That's all what we're trying to do is tell you that it all matters. ED can show up 3 to 5 years before you ever get a heart attack. So it's important. This line right here should make you pay attention. ED can show up 3 to 5 years before you ever get a heart attack. All right? Your body's trying to tell you something. Now, you say, well, I go to my doctor. Why do providers don't go into a deep dive like this? Dude, let me make it simple. They ain't got time. If you go to your primary care doctor has to take care of all of this, all of that. They are handling so many different situations. Very smart people. But the thing is when it comes down to the whole thing of erectile dysfunction, which is this in the big picture, right? They're just going to write you a script. What are you going to get? You're going to get one of the PD-5 inhibitors, Viagra, Cialis. All right? If it doesn't work, you come back and say, Doc, I'm still having problems. Then they're going to send you to a specialist. That will be a urologist, like me. All right? I'm trained in urology. Now, but here's the problem. There are only so many urologists in the United States. So there's limited access to urology because we're a specialty. We're specialized doctors. It's a very hard field to get into. All right? Now, the thing is that sometimes when you try to get an appointment, it may take you 3 to 6 months just to get in front of a urologist. But then once you sit down and talk to the urologist, he's got to deal with insurance issues. Why? Because insurance controls medicine. So the thing is that insurance companies do not pay for erectile dysfunction. So is your urologist going to do a deep dive into erectile dysfunction? He ain't got time and he doesn't get paid to do it. All right? So the thing is that basically, even if he does do a deep dive for you, when he fills out your paperwork and he sends it to the insurance company is going to deny payment. Why? Because they don't pay for erectile dysfunction. Yep, he tried to help you out knowing that, hey, I ain't going to get paid for my time. That's how it goes. Insurance controlled medicine. All right? Now, here's the difference. At Your Heart for Men, we don't accept insurances. That means this is what we do. So yes, we can do a deep dive because we don't accept insurances. So there's no control here. Not from insurance companies. So the thing is that if you want that tailored treatment to your erections, you got to set up an appointment with us. Why? Because even your own urologist can only go so far because he's limited by time and insurance. Your primary care doctor, that's not what they're trained in, so they're going to write a script and then they're going to send you somewhere else. All right, so if the issue is a blood flow issue in most cases, then the real question is how do we improve blood flow? Now, there are several things that we can do, but we try to regenerate the tissue. You say, well, how do you do that? We can do things like a pea shot, whatever, take your natural healing factors. We try to look at your lifestyle because we want to optimize. We focus on circulation problems, but all that's directed at blood flow. All right? We got to also look at, could you have a nerve problem? Could you have a desire problem? Is it a psychogenic problem? All right? Are you noticing changes in your firmness, guys? Do you still wake up with morning erections? Because that's kind of telling you right now that the system's working. Has the medication stopped working and you just don't know what to do because it's not really helping you anymore? Then you know that you need to give us a call. All right? That is Urohard for Men. You can go to our website, which is urohard.com. That's UROHARD.com. Or you can actually give us a phone call, 478-225-9324. If you want to watch from afar, go check us out. We're on all platforms. If you want to hear more in-depth information, go to our YouTube channel. Please subscribe and join so you can catch all the other information out there. And listen out because our podcast is going to start popping. That's happening also. Basically, these talks are educational talks. I'm giving you the information that you're not going to get from your primary care doctor or your urologist simply because that's what the primary care doctor is not trained in, and the urologist ain't simply got enough time, and he's been controlled by the insurance companies, and that's how it works. So understand this: ED isn't just about the bedroom. It's about your vascular health. Fix the blood flow, and you can change everything. That's how it goes. Now, I can tell you I went in depth. I talked about a lot of stuff. This was a deep dive into blood flow and things of that sort. You know, you might have to go back and re-listen to all this to capture it all. My plan was not trying to teach you all that information, but I was trying to get you to have an appreciation of the cascade of events that happen when you go from having no erection to having an erection. All you know is you come in and you say, I got erectile dysfunction. And then I got to figure out, what are you saying? Are you saying that I can get erection, but, it goes away? Are you saying that, hey, I can't get an erection at all? Could it be a neurological problem? What else can be going on? Could it be a psychogenic problem? So we have to do kind of a deep dive. So guys are much more complicated than what we thought, than what people talk about. Now, I don't know if there are any questions out there, but wow, I'm coming to the end of my talk because I've said so much. If you got questions, any questions out there? Because I know I've hit you guys with a lot. Okay. So the thing is that there are not a lot of questions out there. Why? Because it's not our usual day. We're actually going live on a Wednesday. We usually go live on Thursdays. So we know we've kind of developed a listening audience. I hope everybody gets this information because this was a deep dive into what's actually happening and the pathway, the cascade of events that happen when a guy gets erection. This is your baseline information just to kind of understand where all this other stuff is coming from. Why are they telling you to take nitric oxide? Why are they trying to tell you to do certain exercises in the gym? Why are they trying to tell you that, you should take, Blue Chew Roll and all these other kind of things? How is this really truly affecting your erections? Why do you get, stuffy nose and headache and all this other kind of stuff when I take these medications? What do you do when the medications don't work anymore? What are the medications actually doing? It's a lot. But until you see me again, horns up.